Hello, everyone. I am Maureen Dobbins. I am the Scientific Director of the National Collaborating Center for Methods and Tools, and I will be taking us through the COVID and resources today. And we're really, really pleased to have you with us today. I guess for some it's the afternoon, maybe some it's the morning, and maybe good evening to others that have joined us from many different countries across the world. So we're absolutely delighted to be able to host this webinar today. I just want to also thank Claire Howarth, a research coordinator with the National Collaborating Center for Methods and Tools, who was instrumental in developing the work for today and is also supporting me as we go through the webinar today. So just a little bit of housekeeping as we get going. So we are using a brand new webinar platform. It's our first time using this, so we're a little nervous as although we've done lots of testing, sometimes you never know what's going to happen on the actual day. So please bear with us if we experience any technical difficulties as we're really just becoming more familiar with this new platform. We'll try to iron them out as quickly as possible. We do recommend that you use a wired internet connection for the webinar. For best results, if possible, use the latest version of Google Chrome or Firefox. If you do have any technical difficulties, please send a private message to admin NCCMT, and we will be able to respond to those requests. We'll do our best. If you do have questions throughout the webinar, please send them to the public chat, and we will address those questions at the end of the webinar. We also will be doing a few polling questions today. When they are open, they will pop up over the slide. Please note, for some of you, there might be a slight delay in the polling question popping up, so just be patient. Once you enter your response, press submit. If you select to do it later, it will go to your open queue and can be completed at any time during the webinar. So we're just showing you there what that would look like. Okay. And after today, the slides and the recording will be available probably in about 2 weeks' time. The recording will be posted on our YouTube account, and the slides will be posted to our SlideShare account. And we will also send out tweets when they are posted, so keep an eye out for our Twitter at NCCMT. So we're actually just going to start with a couple of polling questions. So first, just interested in knowing how many are watching today's session with you. And actually, this would have been something we would have done pre-COVID, where sometimes we have entire teams that are sitting in front of a screen to watch our webinar. So I'm thinking today there's probably going to be mostly just me's that are providing that in this new time of COVID. And another question, have you visited the National Collaborating Center for Methods and Tools website or used its resources before? Just interested to know if you've been aware of us or if this is the first time that you're joining us. And another question we also have is, if you stated yes that you have been to our site before, how many times have you been here? First time, you've been here once, or are you someone that comes very frequently, visited us more than 10 times? Okay, well, thank you for your responses to those. So I'm just going to tell you a little bit about the National Collaborating Centers for Public Health in Canada. There are actually 6 of us located geographically across the country. We actually were developed from SARS, and a number of the inquiries looking into issues related to SARS identified this important need of being able to mobilize the best available evidence quickly in times of crisis or in a pandemic, and also to develop the communication patterns and the ability to know what to do with that evidence and how to apply it to practice. And so the centers evolved from SARS. We've been up and running for 12 years. And as you can see here, we have the National Collaborating Center for Determinants of Health, which is on the East Coast. As we move west, we have the National Collaborating Center for Healthy Public Policy, which is located in Quebec. We're located in Hamilton in Ontario, the National Collaborating Center for Methods and Tools. We usually shorten that to say NCC. And then as we continue to head west, we have the National Collaborating Center for Infectious Diseases, and then two are located in British Columbia. One, the National Collaborating Center for Environmental Health, and the sixth one is the National Collaborating Center for Indigenous Health. And we share a mandate, which is to help support the use of the best available evidence within our respective domains amongst the public health workforce. Not only primarily in Canada, but it's also now evolved that many use our resources all over the world. We're also here to help support and develop the creation of development of capacity to be able to use that evidence in day-to-day practice and policy making in practice. And just a little bit more specifically with the National Collaborating Center for Methods and Tools. So we are specifically focused on helping to build knowledge, skill, and capacity to use evidence, to be able to appraise evidence, to be able to interpret evidence, and to know how to use that in decision making. We provide that in a number of ways, mechanisms to suit a very broad and diverse workforce in Canada. We have a registry of methods and tools that houses about 150 or so resources that are relevant to evidence-informed decision-making or knowledge translation, others might use that term. Those are tools that have been created by people all over the world that are all trying to help support the use of evidence in policy and practice. And we've put those tools can all be accessed through this single source registry. We also have a variety of online learning opportunities, a suite of online learning modules, as well as a variety of podcasts and videos that one can access to develop their knowledge and skill and capacity for evidence-informed decision-making. We do a variety of workshops. Something that COVID-19 has really made us look much more closely at is how we'll be able to continue to offer workshops in a virtual way. We're already experimenting, but we're much more seriously investing how we can turn our existing face-to-face workshops into virtual opportunities. We have a number of repositories. One of them is Public Health Plus, but there's also Health Evidence, which is a repository of systematic reviews evaluating the effectiveness of public health interventions, all with the methods of those reviews critically appraised by two raters independently, and those assessments are available to you if you access the site. And Public Health Plus includes anything, many single studies coming out. It's a way to stay really up to date on a daily, weekly basis of what is new emerging in the public health literature. We are adding to this as it becomes available through McMaster Plus, which is finding new COVID studies as they're relevant to public health. Those are being added to Public Health Plus, and as well an appraisal of the quality of the methods. We have a variety of videos. Probably the one most accessed is our Understanding Research Evidence videos that look at a number of mostly statistical terms that you'll see when you're reading public health literature, and we've tried to provide videos that break those statistical terms down into very easy to understand concepts, and provided that in a video format. And then finally, we also do networking and outreach. So we're in our constant outreach to public health across the country. We're trying to make sure that what's going on in St. John's, Newfoundland can also is known to those that are at the very other end of the country, anywhere you are, to really try to understand what others are working on, and if there's ways that people can be working on things together as opposed to duplication of efforts. That's a major role that we're trying to fulfill as well. So I've been the scientific director of the NCCMT for 8 years now, and we are really thrilled to have been awarded 8 more years of funding, which will bring our funding period to 20 years. So we have a lot of work still to do, and we're really excited to share with you today some of the resources that we've had the opportunity to develop and also to participate in with respect to COVID-19. So just before we get started, a couple of the resources we've created at NCCMT to support work that's going on in Canada and may be relevant elsewhere. 2 new resources. One is a rapid review repository, and the second is a rapid evidence service. And so I just want to, this is where I'm getting a little nervous, but I'm going to try to share my screen so that I can actually show you those resources very quickly here. So this would be on our homepage. You will see this web page, and you have 2 options here. You can come and take a look at the rapid review repository, and that can be rapid reviews that are either in progress in Canada or completed. And then there are also NCCMT has a rapid evidence service as well, and we've been conducting rapid reviews to support decision making. So just really briefly, I'm just bringing up what this page would look like, the repository. So we recognized very early on that many might have the same questions that they need to look to the evidence for answers to support decision making and programming related to COVID. And we received a couple of early requests to support some local public health organizations that were going to embark on some rapid reviews. That we started to learn, it might very quickly be that we could have four or more health units working on the same synthesis at the same time. So we created this repository. I'm just going to scroll here so we can look at it. We created a repository where people can submit to the repository reviews that they're working on, rapid reviews that are relevant to public health. You can see here that we have 121 of those that have been submitted thus far. You're just seeing a little smattering of them here. You can search by the status of the review. So if you just wanted to know what was in progress, or you only want to see which ones are completed, you can click on those. If we click on the completed one, we can actually see here that 92 are actually completed, and the remainder are in progress. We can also search by public health topic. So we've identified a number of issues. Not all of them are around infection prevention and control. Many of them are along the lines of regular public health practice. But for example, if we looked at disease characteristics, we can see that there are 17 reviews that have been posted here that are specifically addressing characteristics of COVID-19. So just something, I just wanted to give you a quick look at that. We also can look at the jurisdiction. Where has it come from? Whether it's within Canada or international. as well as the setting and the population. So just an encouragement, if your organization has done a rapid review that is relevant, that you want others to know about, please submit it. Let me just go back up here a little bit. We have a form here that if you click on this form, that'll prompt you for a very minimal amount of information, and it will automatically populate this registry. And then hopefully it's might save someone time if they hear that that a review that they were about to embark on has already been done or is being worked on. We know that since we launched this only about 2-3 months ago, we've had about 20,000 visitors to the site. So obviously it's something that people are looking to really help inform what they're doing, and we have anecdotally heard that it has avoided some folks starting a review when they saw one in here was either done or about to be done. I'm going to just try to back us up here and take us to, as well, our Rapid Evidence Service. So the National Collaborating Center for Methods and Tools, we are also here to support public health needs for evidence syntheses for rapid reviews. And so if you have a question for a rapid review that you don't have yourselves the time or the capacity to do, please send us an email at nccmt@mcmaster.ca. I can't promise that we can do every single question that we might get, but we will certainly do our best to turn around quickly rigorous syntheses of the evidence. And we have been working on a variety of rapid reviews for the past few months. I'll just take you one here, which was on alcohol. So what is the effect of COVID-19 pandemic on alcohol use and alcohol-related harms? What we're doing is we're looking to see what is already out there and then doing syntheses. With respect to alcohol, at the time that this was conducted back a few weeks ago, not a lot had been published yet on the effect, so we will continue to monitor this. Okay, so I'm just going to bring us back to our slides. Just bear with me here for a moment. So now I want to jump right into why you're really all here, which is to learn about COVID-End and talk about what is the purpose of COVID-End and show you, walk you through what the resources are. And I'm also going to do some screen sharing. Hopefully that worked okay. Show you some screen sharing of the actual site and walk you through some of the resources that are there. Sorry, I'm just going to, instead of, I took you right to these pages instead of showing you just the slides there. So I'm really, the rest of this presentation really was created. We're borrowing the slides from Dr. John Lavis and Dr. Jeremy Grimshaw, who are the two co-leads of COVID-End and really the two that have, pulled all of this together and really quite amazingly have pulled together a very large group of organizations, all on a volunteer basis, with a mandate of trying to support response for COVID-19. And so these are slides that they've created, and we're building off of those slides. And so really just as a bit of a background, COVID-End, we really have, this has been created as a time-limited network. We are hoping that by bringing folks together and helping to work together and collaborate in terms of the synthesis and the conduct of research in COVID-End, that eventually COVID-End won't be needed, that the resources will be there to help all of the various groups involved in supporting decision makers will access these resources that the purpose behind COVID-End will no longer exist. But at this point, we're trying to make the most of the explosion of interest in and demand for evidence syntheses related to COVID. We're trying to make the evidence ecosystem even more robust and resilient in the future. So can we create a way, a mechanism, systems, platforms that if in a new crisis, if a new crisis were to emerge, we would already have a way to bring together the many, many different studies that might emerge in a new topic, and similar to what we've seen here with COVID. And we also are, another major goal of COVID-End is to support and strengthen existing institutions and processes. So there are many groups around the world that are and have been for many years conducting very rigorous syntheses, and we're wanting to even help support more of that very rigorous work around the world. This slide is probably already, not probably, it's definitely out of date. It's only a few weeks old. These are some of the current partners that have come together in COVID-End. They represent all areas of the globe, multiple languages, we have a partners meeting once a week. On Thursdays, we have new members every week, and we've been meeting since April. And so we're constantly searching for new groups, and if you want to approach us about participating, please just let us know. But that's just giving you a bit of a snapshot of what the current partner list was as of a few weeks ago. So there's three of 7 principles that underpin COVID-End's work. We're here to support, not to compete or replace those already well-positioned organizations that are working in close partnership with key target audiences and already responding to those evidence needs. So we're not trying to replace anything. We're just trying to say, if you are an organization that is answering decision makers or policy makers' questions about issues related to COVID, we want to make sure you know what where to go to most quickly get the best available evidence that's already been synthesized. If it's already been synthesized, even better that you don't have to go through the single studies. So we want to make it easier for all of those organizations to find what's there, and we saw very, very quickly there was too much there for most to be able to work their way through it. So now it's trying to hone in on the best of what's there. And then with supporting with a common brand identity, a small agile secretariat, and a variety, several working groups. So it's a distributed network of organizations and individuals that are playing to their comparative advantages, and we're also trying to leverage each other's work. And we're also looking for those quick wins, for those that are supporting decision makers and those that are involved in preparing evidence syntheses. We know right now the time is of the essence. I didn't think I would ever hear myself say this, but something that's 2 or 3 weeks old is almost too old because the evidence is just changing on a daily basis. So how can we help those that are supporting decision makers know where to go so they can try to stay up to date with that evidence as it's emerging on a daily basis? So how can COVID-End help? There's a variety of resources we'll go through here, but we'll talk about the website. There's the guide to the best of the best resources for if you are an organization that's supporting decision makers. There's a page that looks at tips and tools for how to go about doing this work. There's a taxonomy of breaking down the different types of questions, and I'll get into that in a moment. We have a couple of different new models of a rapid evidence profile that John Levis's group is doing, and it's one example. There are many that are happening worldwide, as well as some work around evidence contextualization service. I'll tell you a little bit about the working groups and a little bit about some of the achievements so far. and then finish off with a new listserv that we are soft launching next week that you may be interested in participating in, and then would also love to hear some of your ideas as well. So in terms of the website, the website's really been divided into two different target audiences. One is what are the resources you need if you are someone that are supporting decision makers. And so that could be at a local level, could be at a regional level, provincial, state, federal. So there's those resources, and then slightly different resources if you are from the research world and you are doing maybe systematic reviews for the first time, or rapid reviews, or other types of initiatives related to COVID-19. We are, that's what the site is primarily for. So I'm going to attempt to share my screen again. And I'm just going to show you briefly here. So if you haven't been there, if you put in covid-n.org, I believe is, sorry, just a minute, yes, you should come to this page. So COVID-N, this is the home page for COVID-N, which is housed within the McMaster Health Forum broader site. And on the site, there you will see here just a little bit about what is COVID-N about, what are some of the different types of resources that are housed within here. So I just really, in this slide, want to draw your attention quickly to, if you are looking for resources to support decision makers, if you are someone who is supporting a decision maker and you click on this tab, you can go to the guide to key COVID-19 evidence sources. You can go to the taxonomy of decisions. You can go to the evidence packaging resources, so a really fantastic resource that gives suggestions on how to package the results of those syntheses for different kinds of audiences for maximum effect. There's some other support, the evidence support models, and then tips and tools. If you are a researcher and you're looking for some additional help, there's an interactive flow diagram. There's some help on clarifying an issue or decision to be informed, suggestions on where to go to avoid duplication. So you have an idea to do a review. Well, before doing anything, go take a look at what's already been there. It might not, you might not need to do that review, or it could be that one is out of date and it needs to be updated, and that might be what you might be putting your efforts into. So I'm just going to stop sharing my screen here for a moment and take us back to the slides. So that's a little bit about how the overall website is organized. As I know that we asked you ahead of time what were some things that you wanted to learn from the webinar, and some of you had expressed a little bit of trouble in finding what you were looking for on the website, so I wanted to go through that. Here, I'm going to take you back to the guide now. I'm going to go through a few slides, and then I'll show you these when we go back to the site. So this there's a guide that is being added to on a regular basis. This guide is identifying who were all of the players, who has gotten into this space of looking for, on a regular basis, the emerging evidence on COVID. And that can be at single study level, that can be at the rapid review level, that can be at the systematic review level, that can be at the best practice guideline level. So this guide is kind of like the Coles Notes of those organizations, and all of the links to those organizations that are doing these various activities have been identified in the guide. And I'm going to bring us back to that and show you that in a moment. Then we also have a tips and tools page, and And so these tips and tools for supporting decision makers, 2 of the tips are about making sure you have the right team and relationships in place to be able to respond to decision makers' needs. 6 of the tips focus on creating the right processes to respond to requests coming from decision makers. So, for example, looking for quality rated products, so doing critical appraisal, documenting when the search was done. So some of those things that make it very, very easy for a decision maker to be able to see how recent not only was the document, but the search, what is the quality of the evidence, those types of things. And then there are 2 more tips related to the right balance between being reactive and proactive. And so we all know right now it's very hard to not be reactive to issues as they emerge, but also forward thinking about what might be the next issues that we think are going to be coming so that we could get to work on doing some of those syntheses. And then the taxonomy. So John Lavis put a very great deal of work into thinking about the types of questions that are being asked and how can we really divide those out. So there's a set of items related to public health measures, particularly around infection prevention and control, as well as broader measures, the clinical management, health system arrangements, and economic and social responses. So then thinking about what types of evidence would be answering various questions related to these 4 broad topic areas. And what can the taxonomy do to help us? Well, in terms of it can help us curate the existing evidence syntheses, technology assessments, and guidelines so that we can look at perhaps searching one portal and have these types of the various taxonomies as filters. It's going to help inform the prioritization of questions that need to be answered as those issues emerge. It's going to help us identify what reviews need to be kept up to date for the foreseeable future. So another word you might be hearing is the living systematic reviews. And then also from horizon scanning, really thinking to the future as the future phases of the pandemic occur, being ready for that. So thinking, maybe 6, 12, 18 months out, what are the questions that will need to be dealt with so that we can get to work on answering those questions now. So I'm just going to go back and share my screen again to show you a little bit more concretely what I've been talking about here. So let's go back here to the resources to support decision makers, and I'm going to take us to the guide. So we just shortened this to the guide. Sorry about that. So I'm just going to scroll through the way the guide has been developed. So these are various resources that one can go to access different kinds of information. So sources of living guidelines developed using a robust process. We could go to this National COVID-19 Clinical Evidence Task Force. So that really, as a start, if you have a question that you're looking for an answer to, we want to start with very rigorously developed guidelines. This would be a place to start. Then we start looking at sources of recommendations developed using a robust process. Here are a few more organizations. Rapid recommendations typically developed using a robust process. There's a variety of organizations that have been identified here. There's a repository of grade-based guidelines. We also have here Magic app, where you can look for additional guidelines here. For example, the treatment of patients with non-severe and severe COVID-19. So there's a lot to take in here. This is the curated list, but this list itself is still really long. Here's a source of living systematic reviews that you could go to, sources of full systematic reviews. Cochrane, you may be aware, many of you would be aware, Cochrane has developed special collections of Cochrane systematic reviews as well as prioritized Cochrane systematic review updates. So I would encourage you to come and take a look and spend a bit more time than I can really give can't really take you on enough of a tour, but this would require you to spend a little bit of time of getting used to what's in here. Some of these sites may be more relevant for particular questions than others. So for example, with the rapid reviews we're doing with the NCCMT, there's a smaller subset generally of the sources that we're using where we find are the best places to go in terms of having relevant content. So you need to play around with it a little bit in terms of determining which ones are right for your particular area. If we just were to go and take a look at the taxonomy, I'm going to take us to that page. So here again, as I had discussed, there are 4 areas of taxonomy. If I take us to the public health taxonomy, and again, this is all work in progress. If you have suggestions and ideas, we're very happy to hear those and would love to get your feedback on that and different suggestions you might have. But these are some of the specific types of decisions that are needed with respect to the public health component. So, and again, we could be, if we look at different areas, daycares, schools, summer camps, recreational areas, religious institutions up above, hand washing, the wearing of masks. So that's just for the public health measures. If we went into clinical management, the taxonomy there, again, broken down into clinical treatment, screening and testing, drugs, ventilation, and other types of clinical management. And I'm just going to take us back out of there. Now, if we wanted to, I'm actually just going to quickly go down here to the tips and tools. So if you are an organization that is supporting decision makers or policy makers, so there's just this page has been created with some tips about making sure you have the right team and relationships, making sure you're using the right processes, and as you can see here from the highlighted, this is then hyperlinked back to the guide or this interactive flow diagram I will get to later. So there's other resources here that you can access to help you in your work. And then just around here about evidence packaging resources as well. Oops, sorry. If we just come here, I found this hugely useful, and my center has been involved in thinking about how to package evidence for a very, very long time, and I found this to be very helpful and learned some new things as well. So just some principles for evidence packaging, different types of approaches for evidence packaging. So just a variety of tools that might be able to really help your work and streamline your work if you are in that supporting decision makers. Okay, I'm going to stop sharing my screen and take us back to the presentation. One of the examples of a rapid evidence is a rapid evidence profile that Dr. John Lavis and his team are doing. We're aware of a number of different organizations that are providing rapid evidence services to different decision makers. As I said, we're doing one as well at the NCCMT, but this is just one, and really incredibly, John and his team are able to provide these rapid evidence profiles in as little as 3 hours in terms of the evidence and the innovations. And just 3 of the examples here, they looked at screening approaches to be used in non-healthcare settings, international lessons learned from reopening non-COVID-19 activities, and strategies for support and use of masks under shortage conditions. But again, you could, on the COVID-19 website, you could see a more fulsome list. John's group has done many more than the 3 that are listed here. And then as well, the Contextualization Service. So this again is looking at, once a rapid review has been done, it can still be hard to determine whether or not that evidence applies to your local area and what adaptations might need to be done in order to make it feasible or appropriate for a particular local jurisdiction. So work is now ongoing to develop a contextualization service that will help people figure out, how can I use this evidence that's been synthesized elsewhere, generated elsewhere, how can I get support in figuring out how I can apply it in my local setting. I just want to talk to you a little bit about the working group. So 7 working groups evolved from COVID-19. And I'll just quickly go through, and the goal was to achieve and document quick wins and get processes up, and hopefully to support some longer-term wins. So the scoping working group is there to support and coordinate what is most needed and what the principles should be to underpin COVID-19, and they've been very helpful in the rest of the working groups and for when the partners come together to help keep us grounded in what it is we're all collectively trying to achieve. In the engaging working group, which I am co-chairing with, Lawrence Langer, is trying to engage those that are supporting decision makers in a more coordinated and efficient way. And I'll talk to you shortly about the listserv that's about to get going. The digitizing group is looking to see how we can coordinate on the digital end and capture efficiencies with the many different platforms that have emerged related to COVID. So what can we do to make it easier to bring all of that evidence together? The synthesizing group has created a resource that pulls together many tips and tools about doing syntheses, whether from a variety of different ways, if it's a systematic review or a rapid review. So really trying to provide resources and support to those that might be new in this space of doing systematic reviews, and also leveraging the knowledge of those that have been doing this for a long time. There's also the recommending group, and this group is coordinating and looking for efficiencies amongst all of those organizations producing best practice guidelines, of which there are many. So bringing together a group that's trying to promote coordination so that we don't have necessarily 10 guidelines all on the same topic being done by multiple groups, but rather really high quality ones, perhaps maybe by a coordinated effort across groups. Then there's the packaging group, which is looking at, again, how do we best package the knowledge gained from syntheses that it will meet the needs of many different stakeholders, citizens, providers, policymakers, researchers, and then providing these types of tips and resources to help. That's also available in many different contexts and languages. And then finally, the sustaining group is looking at efforts that strengthen institutions and processes so that we can be better prepared in the future for future challenges as they emerge. So just in terms of some of the things that, some of the quick things that have come out In the engaging group, we've identified more than 20 networks globally that are regularly supporting decision makers, and we've reached out to them initially to help develop what we're calling the COVID-19 community, where we can be sharing what are we doing to support decision makers within our networks, and to get as many organizations within those networks to be communicating regularly with each other, sharing lessons learned, tips, and hopefully coordinating eventually some of the activities. Digitizing, they've been looking to see, asking us what are the greatest barriers that we are experiencing right now to quickly finding the evidence on COVID that we need, and they are working on developing digital systems that will address that. The synthesizing group has created this tips and tools for researchers resource. The recommending group is moving towards a global guidance repository that will also include a quality appraisal of the guidelines within that. And then, as I discussed already, there's a resource on the webpage around the principles for packaging evidence. So I just want to show you a few more slides here and tell you a little bit more about the listserv. I actually just received, we discussed this morning at our partners meeting, and we're happy to be able to invite you to participate in the listserv. So the goal is to engage with institutions and people supporting decision makers and provide them with information, tools, and resources to facilitate a timely response to decision makers' needs. And we are creating what we're calling the COVID-19 community. We are using a listserv that is based out of the UK that is called the JISC. And the audience would be researchers and or decision makers committed to support sharing and coordination in order to enhance an efficient and equitable COVID-19 evidence response. This was something that all the partners helped my working group identify who those initial groups are, and then we'll be growing from there. So the sign up is now open to the partners. Actually, that just happened today. And we will be doing a soft launch, as I said, on Monday, and starting with two initial discussion topics. One is going to be around those resources for supporting syntheses, as well as resources for supporting packaging of evidence. And then we're doing a more formal launch of the listserv on the week after, on July 20th. There are key links here. So if you would like to sign up to participate in the listserv, you can go and sign up here. You can also find the listserv on this homepage, or you could send a message for discussion once you're signed up to the COVID-19 listserv. And we hope that that will be a useful resource for you. I just want to show you something else here in terms of this interactive flow diagram. This is also on the COVID-19 website, and I'll bring us back there in a moment. But this is really just working through some questions. If you have a question that you think may need a review, this would help give you a couple of decision points. So clarify the issue or the decision to be informed. Looking to see, has it already been done? If it has, can I use it? Maybe there is one, but it's now already dated. Maybe it's a month old, for example, or maybe even older, but maybe you might have the resources to update it as opposed to doing a new one. Or perhaps you found that no, it hasn't been answered, and you are going to move forward with conducting a new review and what types of resources are there. So just a couple of, a diagram that is there to support. So actually, just before we get to questions, I'm just going to share my screen again very quickly, because I do want to get back to your questions. I just want to take you here. So on this part of the COVID-19 website, you can see here the interactive flow diagram. That's what I was just showing you. To clarify the issue, a few resources here that would help do that. And again, thinking about the taxonomy of different types of decisions. In terms of access, in terms of avoiding duplication, is to access existing reviews or identify ongoing reviews that will take you to resources that that would identify those for you. So I just wanted to make sure that you saw a couple of different, if you're more on the research side, where you could go to access those resources. So I'm going to stop there and come back to the presentation, and just ask now for an opportunity for you to raise some questions. I know there were a few that were raised throughout the session, and just bear with me here. I might need a little bit of help in terms of, sorry, I'm just not seeing where there might be questions. I'm just going to scroll through here as well to see if there were any that came up. Okay, great, thank you. And I do see here a question that was asked, do you have information on methodologies for conducting living reviews? So that's a fantastic question. There are some organizations that have been doing that have already pre-COVID were working on living reviews. Back in the guide, there were some organizations that were identified as doing that type of activity, and I think those would be the organizations to go and take a look at, and look at what types of methods that they are using for those reviews, and are they using artificial intelligence to help them quickly find the evidence? How are they regularly adding to it? But there would be some good organizations. There would be some organizations that have some good resources already developed in methodologies that you could take a closer look at. And another question that came in, I'm having difficulty teasing out the differences between COVID and the COVID-19 rapid evidence review. The COVID end has really identified very early that many organizations around the world were regularly scanning the electronic databases for single studies, and then creating a new database of those COVID studies. And others were quickly doing rapid reviews. Others are doing syntheses, for example. And so then what we realized is, as someone who may be responding to a question that a policymaker has, where do I go? Because now I could be going to 15, 20, 30, 40, and actually very quickly we have more than 150 organizations that one could be taking a look at. And so COVID-19 was trying to find a way, a mechanism to identify those, and that's where the guide came from. And then eventually we split the guide between what do researchers need and what do those who are supporting decision makers need to actually shorten the number of resources in the guide. And more work now is ongoing to create an inventory of syntheses that have happened and are happening to answer priority questions that align with the taxonomy that are also critically appraised. So we're continuing to move down along that funnel of hopefully getting to a point where we can only be accessing 1 or 2 or 3 places as opposed to a great many. With what NCCMT has created, our rapid review repository really was a call to what's going on here in Canada. So our mandate is to support public health decision-making in Canada, and we wanted to provide a way for decision makers and or those supporting decision makers to know what types of reviews were ongoing in Canada to address locally driven questions in public health in Canada. So we created that repository, and that repository is focused on public health types of questions as opposed to, for example, treatment, clinical management, health systems arrangements. So it's that one that NCCMT has created is much more narrow and not covering a broader array of all of the questions related to COVID. So I hope that answers your question. I'm just going to scroll down and see if there were any other questions. So I see one just at the bottom. If I need information about the collaboration that government, academia, and the private sector might have had to deal with COVID-19, what would be the go-to place? That is a very good question, and I'm not sure I have a great answer for you. In terms of, so that's definitely something that we can take back as well to COVID-N to see is there something that already exists there. Because nothing is jumping out at me that automatically says that there's a place you could go, one place that would help you with those 3 sectors coming together. But that's a great suggestion. So I see we have a few minutes left. I actually did not, I thought it would be hard to actually get through everything, but if there's any more questions, we have a few more minutes. I think we have a few calls to action for you. So we're interested in hearing about your evidence-informed decision-making in practice. So if you have a story about how you are using, we call it EIDM in your practice, we'd love to hear your story. If you need a bit more support for evidence-informed decision-making and it's relevant to public health, please reach out to us. We'll do our best to support and answer your questions. And we have a few additional questions for you in terms of feedback for this webinar. We'd like you to indicate in terms of participating in the webinar, did this increase your knowledge and understanding of evidence-informed decision-making? Will you use any of the tools that were mentioned in the webinar today in your practice? And so here's another one. I think I'm probably just going a little bit too quickly for my colleague in terms of the questions, but another question again, are there any resources that I will use the methods and tools that you learned about today? How likely is it that you will do that? And I think there's still a few more questions that we have before we let you go, but if you would like to also learn more about our webinars, you can access them at the website here. This question, we're interested in which of the following statements apply to your experience with the webinar today. It met your expectations, it was easy to follow along, so any that apply, we'd love to hear your feedback. And as I had said, as this was a new platform, we're particularly interested in knowing how the experience was for you. Here again, you can see the link that you can access to see other webinars that we've done. We haven't done very many webinars during COVID. I think we've done 2 virtually, but we will be continuing with a more regular stream of our webinars over the coming months. Last one is, can we contact you in the future to discuss how the NCCMT can improve its webinar series? So if you'd like to be able to talk to us about anything else we can do, we'd love to hear from you. So if you have, if you'd like to find out more information about the NCCMT website, you can access us here, or you can always pop us an email to our generic email account. We monitor that on a regular basis. And I would like to thank all of you for attending today. It's been a pleasure to, actually, I feel very out of practice. I haven't done this what seems like for months now. So great to get back into it. It's been really wonderful to have an opportunity to share with you what we're doing at NCCMT and what's happening with COVID-19. And certainly with COVID-19, we're always happy to hear your thoughts and ideas. There is a website that you can also, an email address there that you can reach out to us with your thoughts and ideas as we continue to evolve. So I want to thank you all for today, and I hope you have a good rest of the day. Thanks very much.